A very good morning, dear students. Today, in this video lecture, the prime focus will be on infectious diseases. We are continuing with our chapter that is epidemiology, and this is our third lecture of this very chapter. In this chapter, we are going to study about the topics that we are going to discuss in this video lectures are smallpox, chickenpox, rubella, measles, and one more, that is mumps. So now let's start with smallpox, जिसको कि हम कॉमन लैंग्वेज में चेचक बोलते हैं, शीतला बोलते हैं, या फिर बड़ी माता आ गई ये बोलते हैं. नाउ ये कॉज किससे होती है? ये वायरस से कॉज होती है, और जो वायरस इसे कॉज करता है उसका नाम है वायरियोला वायरस. इसकी खासियत ये होती है कि ये डबल स्ट्रैंडेड डीएनए होता है इसमें, और ये दो तरह का होता है, वायरियोला मेजर और वायरियोला माइनर. और इसकी वन मोर कैरेक्टरिस्टिक है जो इसे दूसरों से अलग करता है, दैट इज इट इज स्टेबल आउटसाइड होस्ट, दैट इज इट रिटेन्स इन्फेक्टिविटी. जैसे ये होस्ट में एंटर करेगा अपनी इन्फेक्टिविटी को दोबारा से रिटेन कर लेगा. नाउ लेट्स अंडरस्टैंड इट्स केस डेफिनेशन. अब इस डायग्राम में जो आप डायग्राम नहीं सॉरी पिक्चर, इसमें आप देख रहे हो एक बच्चे के फेस पे इतने सारे छोटे छोटे ये हो रहे हैं, रैशेस काइंड ऑफ हो रहे हैं. यही एक क्लिनिकल जो है एक पिक्चर है जिसमें शो हो रहा है कि इस डिजीज़ में क्या होता है. ठीक है, अगर हम इसकी डेफिनेशन की बात करें, इसके स्टार्टिंग में जो होता है मैनिफेस्टेशन में फीवर होता है, एंड दैट इज़ 101 डिग्री फ़ारेनहाइट से ज़्यादा होता है. ठीक है, इसके बाद आपकी बॉडी पे रैश होने स्टार्ट हो जाएंगे, फर्म डीप सीटेड वेसिकल्स और pustules. Laboratory criteria for confirmation: PCR identification of variolar DNA in a clinical specimen, or isolation of smallpox variola virus from clinical specimen with variola PCR confirmation. WHO smallpox reference laboratory or laboratory with appropriate reference capabilities. Now let's talk about its epidemiology. Reservoir. Before global eradication, the only reservoir for variola virus was human. No natural reservoir for the virus currently exists. Agents: variola major and variola minor. Transmission. Now the transmission is by airborne route, that is initially by aerosol, then person to person, then hospital outbreaks from coughing patients. Highly infectious. Now infectious material are the saliva, vascular fluid, scabs, urine, conjunctiva fluid, possibly blood. Prevention. Smallpox vaccine is the only known way to prevent smallpox in an exposed person. The smallpox vaccine helps the body develop immunity to smallpox. Now let's talk about the vaccine administration, various method used. The first one is jet gun that you can see in this picture. It's rapid and high maintenance is required. Second one is bifurcated needle, highly efficacious, sterilized and rapidly used. It's less used, mainstay for the WHO eradication campaign. Now there is an end of smallpox. October 26, 1977 was the last date when the last case of smallpox was reported, and May 8, 1980 was officially declared by WHO, was the date when WHO declared that smallpox has been eradicated. Now here in this picture given below you can see the last case of variola minor semiola, that is 1977, and the last case of variola major, that is in Bangladesh in 1975. अब हम पढ़ेंगे चिकन पॉक्स के बारे में, जिसको छोटी माता भी बोलते हैं लेमन लैंग्वेज में। इसका इंट्रोडक्शन बेसिक पहले जान लेते हैं। It is caused by herpes virus. It's a DNA virus. The primary infection is caused by varicella, that is chickenpox. Reactivation of latent infection results in herpes zoster, that is shingles, and short survived in environment. Now let's talk about its case definition. Clinical description: an illness with acute onset of diffuse, that is generalized, maculopapulovesicular rash without other apparent causes. Laboratory criteria for diagnosis: isolation of varicella virus from a clinical specimen or varicella antigen detected by different fluorescent antibody test. Varicella specific nucleic acid detected by polymerase chain reaction. Significant rise in serum anti-varicella immunoglobulin G antibody level by any standard serologic assay. Epidemiology: reservoir, human, transmission, person to person, respiratory tract secretion, direct contact with lesions, temporal pattern, peak temporal pattern, peak in winter and early springs. Incubation period: 14 to 16 days, range 10 to 21 days. Mild prodrome for 1 to 2 days, adults. Rash generally appear first on head, most concentrated on trunk. Successive crops over several days with lesions present in several stages of development. Day 0 to 3. Infection of conjunctivae and mucosa of the upper respiratory tract. Viral replication in regional lymph nodes. Day 4 to 6. Primary virema, viral infection in liver, spleen, and other organs. Day 10 to 12. Secondary virema. Day 14. Infection of skin and appearance of vesicular rash. Treatment. Drug used in the treatment of chickenpox, antiviral drugs, antihistamines, and antipyretics. Commonly used drugs: acyclovir, famiciclovir. Antiviral medicine can be taken orally, intravenously, or applied on the skin. These are prescribed to people with long-term illness, impaired immune system, and pregnant women. Also, other drugs are given to reduce fever, cold, itching, irritation of the rash, sore throat, etc. Prevention. Chickenpox or variola vaccine protects 70 to 90% of those people who are vaccinated. Varicella vaccine contain live virus and so is not recommended to children having compromised immune system or severe illness. The vaccine is given to adults, which also prevents shingles. Side effect of vaccine is redness or soreness at the site of injection. Some folk medicines that are used to treat chickenpox are shown in the in the pictures given below. Aloe vera, garlic, valerian, lemon, ginger, St. John's wort, calendula, echinacea. Next is rubella. From Latin meaning red, little red. German measles, discovered in 18th century, thought to be variant of measles, Toga virus, RNA virus. Case definition. Clinical confirmation. Rubella cannot be confirmed clinically. Laboratory confirmation is required. Laboratory confirmed rubella case. Because of the difficulty of clinical diagnosis of rubella, laboratory confirmation is required. A laboratory confirmed case is a suspected case with a positive blood group for rubella, specific IgM. The blood specimen should be obtained within 28 days after the onset of rash. Suspected rubella cases. Any patient of any age in whom a health worker suspects rubella. A health worker should suspect rubella when a patient's present with fever, maculopapular rashes, and cervical, suborbital, post-auricular adenopathy or arthralgia or arthritis. Control and prevention. Rubella vaccine. Composition, live virus, efficacy, or more. Duration of immunity, lifelong. Schedule, at least one dose should be administered with measles and mumps as MMR or with measles, mumps and varicella as MMRV. Measles, and it's caused by morbella, rubiola or red measles. It's an RNA virus, paramyxovirus, rapidly inactivated by heat, sunlight, acidic pH, ether, and trypsin. Highly contagious viral illness, first described in 17th century. Nearly universal infection of childhood in pre-vaccination era. Common and often fatal in developing countries. This picture of a child depicting how to recognize measles. Now, how can we control it? The very first and effective method is the use of vaccine. In the USA, 1963, killed and live attenuated vaccine is licensed. In 1965, live attenuated. In 1967, killed vaccine is withdrawal. In 1968, live attenuated. As 1971, combined MMR vaccine licensed. In 2005, combined MMRV vaccine is licensed. Now let's start with mumps. Mumps. More than 85% of children becomes susceptible to mumps by the age of 9 to 12 months and continue to be so in the first 5 years of life. It is estimated that about 8.5 to 9 lakh cases of mumps occur in our country every year. The symptoms, signs of mumps. Obvious sign of mumps is swelling of parotid region because of acute parotitis. Swelling usually lasts for 10 days with fever, earache, difficulty to talk, eat, open the mouth for 1 to 6 days. Mumps affect various organs like salivary gland, parotid gland, kidney, testicles in males, ovaries in females, pancreas, breast, and joints.